Headaches are one of the most frequent reasons for people to seek medical advice. It is the primary complaint at presentation of 10% of chiropractic patients. There are many different types of headaches. The most important thing is to first establish whether the headache is benign in origin. A benign headache is not associated with any specific injury or disease process, but may result from a number of contributing factors. Some of these have been identified as 1. Psychological, 2. Vascular, 3. Biomechanical, 4. Environmental, such as food sensitivities or sensitivity to barometric pressure changes. How does treatment of your neck help headaches? The cervical spine or neck sits adjacent to the brainstem and head. The blood supply and nerve supply to the head are intimately linked to the anatomy and function of the cervical spine. Problems in the neck can therefore result in headaches. These are known as cervicogenic headaches and are created by the following. 1. Referral of pain from joint dysfunction. Pain-sensitive nerves are found in the joint structures, and when activated, they can cause headaches. 2. Referral of pain from cervical neck musculature. Areas of irritability in the muscle, known as trigger points, cause pain to travel to the head. 3. Nerve irritation, as marked in the following diagram of the cervical spine, can also result in headaches. A suboccipital nerve that supplies the back of the skull where it comes out between the base of the skull and the first vertebra. This nerve can be irritated by tightness of the fascia and musculature in this area. B. There has been evidence now that a ligament between the upper two cervical vertebrae attaches to the meninges, which cover the spinal cord. Traction on this ligament when these vertebrae do not move correctly results in nerve irritation. C. Irritation of the autonomic nervous system alters the vascular function in the head and can trigger a migraine-type headache. Chiropractic adjustments with the benefit to joint movement, muscle tone, and the nervous system are very important to include as part of any strategy to reduce the frequency and severity of headaches. Chiropractic diagnosis. A proper examination involves 1. A detailed history. This helps to exclude disease as a cause and identifies trigger factors. 2. Manual palpation of the joints. This is to assess for restriction of the specific vertebral movement. 3. Palpation of the musculature to determine if there are trigger points that refer pain to the head. 4. X-rays to look for degenerative change and for loss of correct alignment concerns. Treatment. 1. The chiropractic adjustment. This improves joint movement and removes stress from the structures of the joint and the cervical musculature. 2. Stretches. These are done at the clinic with the assistance of the doctor or with specific home exercises. 3. Dietary and posture lifestyle counseling. This is used to address the other factors that have been identified in the history that may increase susceptibility to headaches.